we go forward in the presentation today. Okay, so let's move on to the actual process of conducting the risk assessment. And it's going to be broken down into steps. And so this first step is determining your scope and setting aside time to determine sort of how you're going to execute this risk assessment. And so as part of this first step, the first thing that you'll need to determine is, is this a project that you're going to take on alone, or is this something that you're going to have some assistance with? And every organization is going to be different. So you're going to have some compliance departments that is a department of one, and then you may have others that is more of a team environment where you have multiple compliance professionals working within that department, responsible for different pieces of the program and operation of the program. So, so my recommendation would be, to really what you want to do is try and assemble a working committee that's going to assist you, through each of these steps, and it should be made up of some sort of cross-section of representatives from the organization, so that you're getting a diverse perspective, as it relates to conducting the risk assessment. And so, one area that might be a logical place to do this, especially if you are just a compliance department of one, is to leverage your compliance committee and have that particular committee also assist you with conducting the risk assessment. So that may make sort of logical sense. Another option might be is if you do have a compliance department that is more than a team of one, then leveraging those other individuals within your department to assist you with this process. But that would be my recommendation, is to not take on this alone. You can lead the process, but it would really help give a diverse perspective if you had multiple individuals that are there to assist you, so you can get different perspectives. So a couple things just to talk through when we're talking about determining scope. These are some questions that I would include sort of just to keep in the back of your mind as you're going forward, and sort of thinking about, what resources do you have available within the department for carrying out the risk assessment, which we've sort of just alluded to a little bit ago. But then also thinking about the back end. And so, if you are going to list certain projects on your work plan eventually, what resources do you have available? Are you a department of one? Do you have multiple individuals within your department that can assist with carrying out some of these items? If you are a department of one, are you loading down your work plan with too many projects that is not reasonable for you to carry out, considering you've got other responsibilities, day-to-day responsibilities that you have to maintain as well? And then, make sure you include a cross-section of departments and service lines. I'm going to talk about that here in just a sec. And then also keeping in the back of your mind, what strategic or financial objectives, are out there within the organization that need to be included in that risk assessment. And if you don't know that, that might be something that may come up through gathering information, the gathering information stage, when you go to conducting surveys or conducting interviews with those in leadership. Okay, so a couple different areas to focus on to help sort of determine your scope. And the first thing is sort of looking at, what are the potential departments, what are the potential service lines that need to be included in the risk assessment. And I just listed up there some examples, so it depends upon your organization and types of services. Some of those may or may not apply. But essentially, you want to have some sort of cross-section of departments that are on the clinical side, if you have clinical operations within your organization, and then on the administrative side. The other area is making sure that you generate some type of initial identification of issues list. That's what I tend to like to think of it as. And really what this should be is sort of identifying what do you think are the potential issues that are out there that you need to focus on with the risk assessment. If you've been in the organization for any number of time, or any period of time, you might have a little bit of a radar about some of the things that have been voiced to you in the past. And I'll talk a little bit about, in a sec, sort of some resources that you can use in sort of generating this list. But something I would recommend is, if you are utilizing a committee to help you in conducting the risk assessment is have everybody on that committee generate this list. And again, that way you're going to get a different or sort of diverse perspective about what they think are the potential issues that you need to focus on with your risk assessment. And you sort of get those multiple viewpoints. And then what you can do is have everybody complete it, turn them back into you if you're the one that's overseeing this process, go through it and identify what particular trends there are, and then sort of collectively decide, what is going to be the overall initial identification of issues list. The reason why this is good is it helps give sort of a snapshot in time about what you think is out there as potential risk, and then that will help. It'll either get confirmed or there'll be some adjustments made to this, as you go forward into gathering information and evaluating risk, which are some steps we're going to talk about a little bit later on. But really, and this is sort of an overall point, is something to keep in mind is when we're talking about determining scope, all we're really doing here at this particular stage is just a preliminary determining of scope. You're never going to have it in a final stage because you haven't gotten to the gathering information process yet, and typically new issues are going to pop up when you get to that particular stage. So determining scope should really be a fluid process. It should start with this initial identification of issues list, and then you're able to add things as you go forward and collect information from others. So I've got listed up here in the next couple slides just some internal and external resources that you can consider when developing this initial identification of issues list. With regards to internal resources, are you under a CIA or is there an OIG settlement out there that you're aware of? Are there any hotline reports you've had in the past or any trends in that particular area that might identify some potential issues you need to include on that list? Take a look at the compliance or the work plan that's been developed for the compliance department for this particular year. Are there projects that need to be carried over from that didn't get completed? Also looking at the, we'll get to that next, the external piece of it, but I was going to say the OIG work plan you'll need to take a look at as well. But these are just some different areas, things that you can consider with regards to internal resources when you're developing that list. And then there's just some additional ones. I included this up here. Don't forget about employee satisfaction surveys, physician satisfaction surveys, patient satisfaction surveys. These are always typically ripe for complaints that have been made. And sometimes those complaints are frivolous and they don't include an actual compliance concern, but sometimes they might. And so don't lose sight of that. So that's why it may be helpful even to have an HR director or somebody in HR that's on this committee with you to help determine risk if you can leverage that type of resource. And then here are just the external resources. I mentioned the OIG work plans are here and the OIG Pass Compliance Program Guidance. These are some other ones you can consult. Any notable government settlements or enforcement trends, that have popped up this last year, or OIG advisory opinions, anything that's sort of signaling that there's a concern. An example of that would be a few years ago, the OIG and the DOJ came out with a joint fraud alert on medical director contracts. And that sort of sent off a tidal wave amongst a lot of organizations to take a look at their medical director contracts. So that's sort of an example where that plays out. So if any of those types of guidances have been issued, you want to take a look through that and see if there's any potential issues that you want to add to this particular list. And so what you could do is, you could include this listing of these internal and external resources along with your email request or however you're going to request to the others on your committee to generate that initial issues list. Give them a week or two to come up with your list, send it back into you, and then take a look and see what possible trends have popped up and then determine some type of final list. Also, you want to, in this sort of first step, is set aside some time for execution planning. And, a couple things that you want to think about is sort of what your timetable is going to be. Now, overall, and we're going to get to this as we go forward, but there's essentially going to be 4 steps to this process. We're talking now about step 1, which is determining scope and execution planning. We're eventually going to move into gathering information on potential risks, which is where we get into surveys and interviews. After that process is complete, we're then going to shift into evaluating that risk and prioritizing it. And then after that will be the last step, which is developing your work plan and then obtaining approval for that. So what you want to do with the execution planning is sort of map out these steps as best you can, and I would say honestly and reasonably anticipate, what is a timeline to execute these steps. And then also just determine, who is going to help you in completing that work. And as we go forward, you'll sort of see what I mean about some of these tasks that need to be completed. So a couple things to mention on the risk assessment timetable. And I've got that first one there, avoid budgeting in too little time. And as I said, make sure that you're honestly budgeting in enough time to allow for a meaningful effort. In doing that, you're going to be balancing, what other workload demands do you have? What do others have on the committee? Are there large-scale projects going on, such as Joint Commission certification or recertification or reaccreditation, I should say? Are there government surveys going on? Are there other things that are taking place that are going to be a demand on people's time? So just that's what I would say is, avoid budgeting in too little time, because it doesn't matter who you work for in healthcare. We're an industry that is always changing without notice, and emergencies come up, such as an unannounced site survey or a data breach or something like that, and you have to be able to account for those unexpected emergencies, as you're developing this risk assessment process. So just make sure you're accounting for that. The flip side is, avoid budgeting in too much time, because if you do that, sometimes it can cause you to sort of lose momentum in the process. If there's too much gaps in time between, your committee and when they're meeting and moving forward with things. So what I've got here, on this next slide, is just sort of a general map, sort of outline of how long on average it can take. Now, this isn't to say this is going to work for your organization, because every organization is going to be different, whether you've got 50 employees or you've got 500,000 employees. The process is the same, but the amount of time that's allowed for it may be a little bit different. So I would just say this is sort of a guidepost to use. That first month or so is where you want to determine your scope and do the execution planning piece of it. I would allow for a couple months of gathering information between developing your surveys, if you're going to use surveys, sending them out, giving people enough time to respond back, allow for a little bit of follow up and having to chase people down. And then also, allow for some time to sort of go through the responses and see. The other thing is with these 2 months of gathering information, if you decide to conduct interviews, that's something else that can take some time between getting on people's schedules and getting those interviews conducted. So I'd budget in a couple months at least for gathering information, and then another month or so for evaluating the risk and prioritizing the risk. That may not take you a month each for each of those. So you may be able to shorten that a little bit. And then work plan approval, I would budget in at least a month or so. And some of that will be also depending upon schedules and, if you're ultimately presenting this to a board committee, how frequently do they meet? Do they meet monthly or do they meet quarterly? Those kinds of things. So, keep this in mind as you are, going through your particular organization's fiscal year. Some folks, operate on, June 30th to July 1st. Some do January 1 to December 31st. So you need to kind of plot these things out within, your time frame. But this at least gives you sort of a general guidepost to use. Okay, so let's talk through the next step, which is gathering information. And The exact format for collecting information from those key stakeholders or leaders in your organization, it's again, it's going to be subject to sort of what works best for your organization given the size and scope of services. But generally speaking, a couple different ways you can go about gathering information would be conducting individual surveys or conducting individual interviews, doing focus group type discussions. Those are sort of, I think, probably the three main ways most organizations gather information. Or you can do sort of a hybrid approach, and that's sort of what we're going to follow here as we go along in step 2, which is we're going to start by sending out some surveys to a certain defined population, and then we're going to follow up with interviews on selected individuals that had completed those surveys. Okay, so let's talk through the survey piece of it. And if you determine to use surveys for your data collection, then you need to decide or meet as a group and discuss the logistics for conducting the survey. More specifically, what's going to be the method used for the survey? Is it going to be manual? Is it going to be electronic? Are you going to use something like SurveyMonkey or use voting buttons via email, or is there some other type of software you have available that you're going to use? Who's going to be responsible for overseeing the survey process, sending out the communication emails, if you're doing electronic, sending out follow-ups, answering any questions that come up from the respondents, who's going to collect the data, who's going to summarize the data. Those are the types of things you need to decide on. Also, what kind of questions are you going to include? And we'll talk about questions here in just a little bit. And also sort of how many questions you're going to include. Timelines for gathering information. How much time do you want to give people? Again, I would say you want to give them enough time considering other demands on their workload, but you don't want to give them too much time that it falls off their plate and they don't get back to you. And then lastly, you need to determine, who are you going to send the survey out to? I would say, just as a recommendation, you would want to send it to somebody that's at your board level or governance level, at least a couple individuals there, and then a cross-section of those within leadership. And then you would also want to include department directors and then also just general employees. So you're getting that sort of staggered tier approach, because a lot of times there are things going on that general employees are aware of that leadership's not aware of. So I would say, include sort of a good cross-section sort of vertically and horizontally within the organization. Okay, so when it comes to the questions themselves for the survey, you want to ask open-ended questions so that people are required to explain things and don't answer or don't give them questions that could be a yes/no type answer. You want to cover the likelihood of the risk occurring and then what the impact is of that risk occurring, and we'll define those terms a little bit more in detail as we go along here in just a sec. And then I would give those respondents the ability to assign a risk level, and we'll talk about what I mean by that here in just a sec. But this is a good thing to do because it puts them in a position to sort of gauge, how serious this particular issue is. Now, their opinion of these risk levels may vary from yours, and so it is just information you can all take into consideration once you get to evaluating and prioritizing the risk. So I just included here just some sample questions that you could use. This isn't to say this is going to work for your organization, but something maybe to give you a start and something to think through. Probably one of the easiest ones is just to start off with a question that says, please list your top 3 risks to the organization from your perspective, with 1 being the highest risk and 3 being the lowest risk. And again, as you look at this particular question, that is an open-ended question. It's not a yes/no answer. It forces the person to have to actually explain. So that's a good sort of starting point question. And then you can also include a question, your sort of maybe a follow-up one to this, which is having them describe the risk as well. And again, that would be an open-ended question. It would force them to have to explain things. So then from there you could move into several different follow-up questions. And the first being, why do they feel like this particular issue creates risk to the organization? Again, it sort of puts them in a position to have to explain, and hopefully you can draw from that information, how serious is this particular issue? Or is this somebody's opinion? Or are they saying, well, we think this is a potential risk because we have conducted audits, or this particular information is factual, or there's other documentation to point to why this is a particular risk. That type of information will get drawn out from this type of question. And then here's where you got the numbers. So they're assigning a level from 0 to 100%, what they think the likelihood of the risk is occurring. And again, that's just to give you a sort of a guidepost of how serious they think the particular issue is. The next set of follow-up questions you could ask would be with regards to assigning or identifying for them risk different categories. And I think this is a good thing to include because people are going to define risks differently. And so you want to have some type of standardized definition of risk. And so you don't have to necessarily use these, and I've just given you some examples in parens about what we're talking about. But I think when you include this in your survey questions, it then gets that respondent thinking about the types of things that they might not, it might trigger a thought that might not otherwise occur if you didn't include these risk categories. And then I was going to say the risk categories, there'll be some scoring involved with that, which we'll get to a little bit later on. Next, then move into the level of impact, from low, medium to high. What is the level of impact of this, to the organization when they're accounting for, these types of risks? Is this something that would impact the entire organization? Is it just a small department? And again, this sort of helps define sort of how serious the issue is. Another question you could throw in there is, hey, to your knowledge, are you aware of any things that are in place to try and address this particular risk? And the reason why this is good to include is because it helps you in determining and prioritizing risk, engaging, is there something already in place that's trying to address it? Maybe that's what we need to take a look at if we're going to add this project to our work plan. So it's just additional insight and feedback. And then, you can throw in a follow-up, if there isn't anything in place, do they have any sort of recommendations? And that just falls under the bucket of just gathering information and trying to get diverse opinions with regards to potential things that you could put in place to try and correct the issue. Another question you could throw in there is, to your knowledge, has this been audited before? And if so, do they, recall what the findings were? And again, this is just additional information that can help you with prioritizing. Assuming that there was maybe a past audit or something that's been done, that would at least give you something to review and determine, what was identified in that particular audit, and determine, if the findings from that audit were actually corrected, or are they still issues in the organization that need to be addressed. And then I would include, some type of just a catch-all question. And more times than not, they're probably not going to answer this, but at least it might help get their mind thinking about something else they hadn't thought about, previously as they were conducting it. That they should focus on. So I think it's good just to include that sort of a catch-all question. Okay, so let's shift gears now and let's talk about interviews. And this is another area where before you move forward in the interviews, you need to think about sort of the logistics involved and who's going to conduct them, who's going to be helping you get these scheduled, how much time do you need to allow for scheduling the interviews, how long do you want the interviews to go? I would say probably as a general rule of thumb, they should be maybe an hour long. You can always leave it at the end, if you need to do follow-up or something like that. But you don't want to be too restrictive on somebody's time, but you also want to allow for enough time to have an open and complete dialogue. So you just have to sort of schedule that as what makes the most sense practically. And then who to interview. And again, I would say here, if we've decided, I'm just throwing some numbers out here. Let's say maybe there's 100 people that you've decided to send your interview out to in the organization. You might want to distill that down to maybe 10% or 20%, or 10 to 15 people that you would want to interview. And part of the interview is, if you've done this as a supplement to the survey, is just to go over the information included on the survey, ask any clarifying questions, determine if there's any additional information that you need to understand the risks that they've listed. And then also sort of the questions to include in your interviews. And I'll talk about some sample questions here in just a sec. But again, just to recap, that you can either go down the road of just doing interviews, or you can do surveys, or what we're talking about here is doing this sort of hybrid approach. So you really have some flexibility in sort of what makes the most sense for your organization. Okay. So in terms of how to approach the actual interview questions, the first thing you can do is just sort of follow the format from the survey questions, listing out those top 3 risks, asking those follow-up questions, and sort of going at it from that particular approach. Additionally, what you might want to add in as a question is a lot of the whys, and sort of, because a lot of times you're going to get people's opinions, and you want to find out, what information led this person to including this particular opinion in their survey. So you want to sort of drill down, where it is they're getting their information from, or why they think it's a particular risk. So you could go that route, or you could just include some additional questions, and I just listed some sample ones here. Again, sort of identifying the biggest risk to the organization or their department. Are there certain processes or procedures, that they think are the greatest risk of failure? Where do you think there are vulnerabilities within the organization or the department? What issues keep you up at night, and why? These are, again, just sort of general question or general sort of formats you could use, a lot of which is just getting at the same essential question, which is, identifying what they think are the biggest risks. And then if you use any of those questions I had on the previous slide, here are just some additional questions, that you can ask as follow-up. Again, what led them to discovering this particular risk? Are they being managed or controlled? What's the likelihood of it occurring? What's the impact of it occurring? Those types of things. Okay. So that is gathering information via surveys and interviews. Once that is complete, and again, I would probably give a month to 2 months for that particular process, considering factoring in schedules and things like that. It's now time to move into risk evaluation and prioritization. And so something that I would strongly encourage is, you want to designate somebody to have summarized those responses from the surveys and the interviews, so that you can identify potential trends. You could do that in sort of an internal memo report, or you could have it in an Excel spreadsheet or something like that, whatever makes the most sense. And so once we're now at this phase, we're basically going to take a look at this information we've got and determine where we need to focus our efforts. And to get us there, you need to go through some type of sort of scoring that's going to give you a level of risk, or excuse me, a level of likelihood and a level of impact to the organization. Excuse me. Something that you could do is sort of one approach is develop some type of risk assessment dashboard. And this could be something as manual as an Excel spreadsheet with different tabs, and include that initial issues list that we talked about during step one, a risk evaluator, which we're going to talk about here in a second, include your risk matrix, and then maybe on another tab would be your finalized list for your work plan. So it sort of has that snapshot, and it's all in one document from beginning to end. And that's maybe what you could use as your vehicle for documenting your efforts and what everybody would be reviewing that's on your committee, as you're working through this particular process. Another potential route is software. You may have software available within your organization, or there certainly are software vendors out there that do have this type of information that's more automated that you could use as well. Okay, so let's talk through the risk evaluator. And really what we're doing here is this is going to be a tool that's going to be used for scoring the risk. And what we're going to be doing is assigning a level of impact to the organization, and that's going to be in the form of an overall score. And you'll see that here in just a little bit. And then we also want to assign a likelihood score, and that again is also going to be an overall score. And you're going to use those two scores to help determine where on the priority map do you need to focus. And the priority map is going to be your risk matrix, which we'll also get to in a few minutes. But I just wanted to kind of set up sort of where we're going. So with regards to scoring the risk evaluator, what you're going to do, and I've got a graphic here in a little bit that will sort of have this information all laid out that you could use. But you're basically going to have your risk impact score, and this is going to be assigning an individual score for each of these different risk categories: legal, compliance, financial, reputational, strategic. Again, you don't have to use all of these. You could use some of these. This is just sort of a generic set of risk criteria that you typically take a look at. And then what you can do is have everybody that's on your committee populate this and determine this score. And typically your impact scores here, I mean, you can determine whatever your scale is, but just to throw an example out there, you could say, well, the risk impact score is going to be on a level from 1 to 5, with 1 being the lowest risk and 5 being the highest risk. And so that's what you want to assign a number to for each of these particular areas. And then from there, what you're going to come up with is your overall impact score. And that's basically just going to be the sum of all those individual scores that we just went through. And then you would also set up some type of scaling that, 5 to 11 is going to be a low overall impact score, 12 to 18 is a moderate, 19 to 25 is a high. Once you get through assigning the overall impact score, you would then move on to the likelihood score. And again, I just threw some scaling out here. You could determine a different scale, it makes more sense to you, but also just sort of tiering it out so that you've got, what's going to be considered a low, moderate, and high risk likelihood score. And so then what you could do is, and this is sort of what I was saying about just having a sample kind of Excel spreadsheet. So what you could do is sort of list this out. So we've got, risk number 1 through however many, 20 or so, 25, 30, 40. And then the topic, maybe a little brief description of what it is, or maybe some other information. And then these columns D, E, F, and G and H, these are all going to be those individual impact scores, those 1 through 5 scores. And then once you get through assigning those, this is your overall impact score up to a scale of 25 is how I have it listed here. So that's going to be assigning your overall impact score. And then you would determine whatever your overall risk likelihood score is here. And then have everybody on the committee do this themselves individually. And again, that way you're sort of capturing thoughts organically as it's happening. People aren't sharing information, at least at this point. And then the intent is you're going to reassemble as a group or distribute this out via email or whatever makes the most sense. And then you're going to collectively decide on these columns K and L, which is what's the group think is the overall impact score and the overall risk likelihood score. And so once you go through that and everybody's populated those numbers and those scorings, you're then at a position to then populate this risk assessment matrix. And what these are is basically just a tool that's going to be used to help you identify, more than anything, probably visually, where each of these identified risk topics fall on the spectrum of impact and likelihood within the organization. And so the purpose of this really is to help your committee determine, which of these identified risk items do we need to prioritize on the work plan for the next year. And so I apologize, I know you probably can't see that, but this is, again, just supposed to be sort of a visual here. So this is essentially what you could have the matrix look like. You don't have to necessarily use this format, but I've got a quadrant system set up here. Risk likelihood runs vertically, impact is going to run horizontally, and then whatever your numbers are is going to dictate where it's going to fall on this map. And you could, there's certainly software you could do this automated or through Excel, or you could just use poster board or something and do it manually as well. But under this sort of quadrant system that I have set up here as an example, one way to do it is quadrant A is going to be your low impact, high likelihood. So these are going to be low overall impact scores and high likelihood scores. And then quadrant B is going to be high impact and high likelihood. So high overall impact score, high reasonable likelihood score. Quadrant C is going to be low impact and low likelihood. And then quadrant D is going to be high impact and low likelihood. And so generally speaking, your risk topics that are going to be listed in quadrants B and D, those are the ones that are going to be your higher to moderate priority. And those are the ones that are probably going to help determine what needs to be on the work plan for the following year. The A and C's are going to be your lower priority, but having said that, there might be an extenuating circumstance that maybe you feel that's something that does need to be addressed on the work plan. And so you can prioritize it accordingly. Okay. So now we're moving into the final stage, and that is the work plan development and the approval stage. And so just to recap, so far we've covered step one, which was scoping out the risk assessment, doing the execution planning. Step two was gathering information. Step three was evaluating and prioritizing the risk. Now and once we've gone through the risk matrix, now we're at a point where we're starting to get some clarity and things are coming into focus about what needs to go onto the work plan. And so, once you've gone through that sort of overall scoring piece, you should be in a position to, make this determination. And so, and again, this is something that you could work through with your committee. And once you've got that final list of high priority items, then collectively meet as a group and discuss, which items, you think should be on that work plan for the following year. So just some of the logistics with the work plan development. Again, it's going to vary a little bit depending upon size and scope of services of your organization, but generally speaking, identify the top 15 to 20 high to moderate risks, that you think there are. You may be in a smaller organization and it may be lower than that, or you may be in a larger organization that might be significantly higher than that number. But identify these high to moderate risks. Get some type of draft work plan together, circulate it amongst the group, everybody review it, comment on it, what they think needs to be focused on. And then, again, you can use your committee if you want to vote for approval on it, and then just sort of adjust it based on, whatever the recommendations are from your particular committee. And so something that you need to think about with this also, especially if you're the person that's leading this particular project is who is going to be responsible for carrying the work out. Now, if you're a department of one, oftentimes that's probably pretty easy to figure out, and it's probably going to be you. But if you've got multiple individuals within your department, this is where you would determine, who's going to be responsible for completing what particular projects. And so there's a number of different ways you can go about setting up a work plan document. I just produced here kind of a generic work plan based on an Excel spreadsheet. You can break this down by quarter, list the description, what the scope is. Does this apply to the whole organization, or is it just departments of the organization? What your particular objective or goal is going to be, when you anticipate starting it and completing it. Some of these projects may be only one quarter. There may be larger ones that are going to take the whole year. So kind of mapping that piece of it out. And then what is sort of the status and a comment field. And this is a good working tool to help you throughout the year as you're reporting out to your compliance committee or your board committee about where you're at with the work plan and completing these particular types of projects. So the last piece of it with regards to the work plan is just getting approval. And so at this particular point, you should have a finalized draft, from your compliance committee. You've all agreed that these are the projects you want to focus on and the times of the year that you want to focus on it. The next step then would be presenting it to your board or board compliance committee or whoever is the governing body within your organization to approve that particular work plan. And again, budget in time that you need for this, depending on if they meet quarterly or monthly, and then maybe work backwards in your timelines as you're developing those. But I would anticipate, that they may come back with some questions, they may come back with some adjustments or something like that. So you may have to go back and make some revisions and then re-present it for approval. And so once you get everything approved, then you can move forward with the work plan and commencing with the work. But then I would just add in that, once it's approved, there are times when things are going to come up and certain things you had in the work plan need to get either drop off or they need to get pushed to a later quarter or maybe pushed off to the next year, and something else needs to get added. And so when that does occur, what you need to do is make sure that if you're making those modifications to the work plan, you're then representing it to that board or board committee and getting their approval before you make those adjustments and move forward. So just some final comments, and then I'd be happy to open up to any questions. Just kind of a recap I wanted to include here, sort of the process and where we've gone from beginning to end. Again, general rule of thumb, I would say, is maybe 6 months to plan for carrying out each of these steps. I listed up here the risk assessment, or I mentioned the risk assessment dashboard and the risk matrix, the work plan. These are just some various tools that you can develop. I think using these tools is helpful for consistency. If you've got software that you can use for the surveys, that might be another example. But anytime you can sort of develop these tools, it helps establish some consistency, which overall helps establish trust in the organization. And then just, again, a reminder to budget in anticipation of any interruptions that may come up. And so with that, I'd be happy to take any questions that you may have.
Yeah, thank you, Jay, for the presentation. Thank you to all the participants for cooperating with us. Now it's time for Q&A session to begin, and unmuting all the lines to start the Q&A session. So if anyone is having any question, you can ask to Jay. Okay, Jay, we are having one question. I am sending you via email, via chat.
Okay.
Yes, thank you.
Thank you.
Cynthia, are you having any questions? Jay?
Yes.
Yeah, I have sent you via chat. Are you able to see the question?
Haven't seen it yet. Hold on here.
What types of compliance risks exist in the operating market? How severe are these risks?
Okay.
Can I send it again?
Sorry. Yeah, why don't you try and send it again?
Yeah, I have sent you.
Oh, there we go. Okay, there we go. Okay, if I understand right, just what type of compliance risks generally exist within the market? And, again, it sort of depends upon the specific organization and the type of work that they do, but generally speaking, I would say probably highest risk categories are going to be anything billing related if you are billing out government payers such as Medicare, Medicaid, or TRICARE, and then also patient confidentiality or HIPAA if you're managing patient health information. The reason I say those two areas in particular, just because I think those have probably the largest potential for occurring on a day-to-day basis. And then specifically with patient health information, it's something over the years that as we've had more data breaches and things like that, people are much more sensitive to organizations protecting their information. And patients do have the ability to directly complain to the Office of Civil Rights that enforces HIPAA. And so you may get contacted from an OCR agent following up on an investigation or audit based on a patient complaint that you are not aware of. With those two in mind, I would say just making sure you're doing routine audits in areas from whatever you're billing out to make sure that the appropriate documentation is in place and you don't have any exposure there. And then with regards to HIPAA, making sure that you've got a privacy program in place, a security program in place, and then also individually that you're meeting certain requirements such as your notice of privacy practices. It's current, it's posted. How are you handling requests for copies of your medical records? Are you meeting them within the timeline that they're required to be distributed back to the patient? How are you handling breach investigations? Do you have all the documentation in place to conduct breach notifications? Should the OCR conduct an investigation or audit and ask for that information? So those are probably the two sort of generic biggest areas, I would say. In terms of trends, I'd mentioned the medical director contracts. If that is applicable to your organization, that's, like I said, a hot area. Anything related to physician contracts and the compensation that's paid to physicians is another hot area. So making sure that you've got documentation in place that there is a contract, it's signed, you're not operating on an expired contract. Any money that's being paid to the physician is based on fair market value, those types of things. Telemedicine is another area that's popped up as Medicare has started to be more open-minded to fostering the development of telemedicine. There's certain billing and documentation requirements that need to be in place if you are the distant site or the originating site. So I hope that information helps.
Yeah, I have sent you one more question.
Okay.
Can you see it?
I just lost it. Actually, can you just read it out real quick?
How would we evaluate or describe the company policies regarding compliance?
How would you describe the company policies outlining compliance?
Yeah.
Okay. With regards to compliance, there should be a couple core pieces of documentation that's in place. One is a compliance plan, which basically outlines how you're going to carry out the 7 elements of an effective compliance program. And then you should have some type of documentation, memo to the file, or something that establishes that who the compliance officer is, who sits on the compliance committee, and then you have to make adjustments to that memo, as people go on the committee or they leave the organization or something like that. Depending upon the size of the organization, there should be some type of mechanism to memorialize that whoever is designated as a compliance officer is going to serve in that role. So if you have a small organization with boards of directors, typically there would be a resolution or board resolution or something like that that would establish, who exactly the person is that's going to oversee compliance. So those would be some of the key documentation to have in place. And then from the policy standpoint, again, it depends upon the scope and size of your organization, but there should be policies in place that that outline the fact that you're not going to retaliate against employees for reporting an issue in good faith, that you are going to appropriately bill out government payer sources if that is an area of your business, and then refunding any amounts that have been received in error. Policies on gifts would be another area. Conflicts of interest would be another area. And then HIPAA, privacy and security policies should be in place. So those are probably your core set of policies that you should have in place for the compliance program.
Okay, is there any more questions anyone going to ask? Okay, it seems there is no question at the moment, or I hope our presenter answered all your questions. However, we can still send your question to our email ID at webinar@compliancekey.com. With this, we will end the session. We appreciate your time and believe the session was informative and up to your expectations. Soon, you would be receiving certificate of attendance and a feedback form. Kindly send your comments. Your feedback is important for us. Once again, thank you so much for participating in this webinar, and we wish you a pleasant day ahead. Thank you, Jay, for the presentation. Have a great day.
You too. Thank you so much.
Yeah, thank you. Bye-bye.